Hi, I am Vivek Rege. I am a pediatric surgeon and pediatric urologist. And today's topic, I would say, is umbilical hernia in a child. Now, the commonest problem is the parents asking questions like, why did this occur? What should be done about it? Is it dangerous? And what happens if we don't do anything about it? So, I will try to go through certain answers and see if it makes sense to you. First of all, it occurs at birth. Usually, it can be seen within first few weeks at all, and maybe in certain later stages. The reason why umbilical hernia occurs is because during the formation of the child within the womb of the mother, there are four folds. One upper, one lower, one left, one right. All of them come and meet in the center, which finally becomes the umbilicus. Now, if there is a gap where these four folds meet, that gap is full thickness, including the skin and the muscles, and therefore there is a hernia, which is protrusion of contents within the abdomen, outside but under the skin. So, therefore, an umbilical hernia is basically a gap or a defect in the umbilicus through which commonly the intestines of the child protrude. So, it is noticed as a swelling by the parents, more so when the child is crying, straining, or coughing. Now, when this is seen, they say yes, the thing comes out when the child is crying, but then when the child is sleeping, it goes down naturally because the defect is open. So, what comes out can go back in, and when the intestines go back in, obviously there is nothing to be seen. So, that is what I'm talking about is an umbilical hernia. The next question is, what are we supposed to do about it? Now, there is a common grandmother's advice that put a coin there and then strap it tightly and it will close down. For heaven's sake, please do not do such kind of things. Do not listen to what I call free advice. And because that is more dangerous than not doing anything at all. Most of the times, when you are putting that coin, what happens is a small part of the intestine may still be at the edge. You put the coin tightly, you can cause a problem of the intestinal lumen and cause a perforation where there should not have been any complication at all. So what we advise the parents is just don't bother about it, because the natural history of umbilical hernia is that it will close in over 90% of the cases. Now, if that is going to happen, then why are we trying to do any further things just to make it close? If it is going to close on its own, it will close on its own. Only thing is, if possible, we try to allow the parents not to make the child cry too much. If there is a cough, try to treat it as early as possible, so that anything which increases the abdominal pressure will cause the intestine to come out. And therefore, if that does not happen, the natural process will close it over a period of weeks or maybe a month or two, and there is no harm in waiting. Now, the problem is, does it require surgery? Yes, if there is a complication. Now, the next question will be, what are the complications? Now, just as I said, there is a defect through which the intestines come out and they normally go back in. Sometimes, if the child is crying or screaming a lot because of pain in abdomen or some other reason, they come out and too much of intestine comes out and can get blocked. And if it gets blocked, it cannot reduce inside. That's when you can get what is known as an irreducible hernia. How do you know that the hernia is irreducible? Simple, the child is crying. There may be distension or bloating of the abdomen. You are not able to push the contents back inside, which you were able to do previously. The child may be starting to vomit. All these are danger signals, and if there are danger signals, please contact your nearest pediatric surgeon or pediatrician at the earliest. Now, most of the times, even with obstructed umbilical hernia, making the child calm, giving some sort of a sedative, letting the child sleep may solve your problem temporarily. That means when the child goes to sleep, the child relaxes, the intestines may automatically get reduced and nothing more needs to be done at that time. However, once a complication has occurred in an umbilical hernia, then we should not wait any further, and within the next few days, as far as possible, we go in and close the defect and come out. Now, this is a surgical procedure, yes. Is it a major procedure? Now, this is again a common problem which the parents have, that they are always having a mistaken attitude about major. Now, this is a major surgery, but what they are trying to ask me and what I usually tell them is no, it is not life threatening, because that is their main concern. Can this surgery lead to any life threatening complication? No, it cannot. But if there is no life threatening, this is a major surgery, yes, but most of the times it's a very short stay surgery, which means you get admitted on day one, we operate on day one itself. Next day morning, if the child is fine and taking orally, which it usually does, the child can be sent home the next day itself with no other complications. I will. But 90% of the times, children who are brought to us with an umbilical hernia do not need surgery and can be treated conservatively. That means without surgery, just allow them to be natural. Let them crawl, let them fall on their stomach if they are that big. Let them crawl onto their stomach. It does not make a difference. But please do not tie that coin and then put a tight bandage. Don't do anything of that sort. Let it heal naturally. It will heal. There will be nothing more to be done. And umbilical hernia is common but not dangerous to the child.